Welcome back to my channel, and if you are visiting this channel for the first time, you are also highly welcome. In this lecture, we'll be looking at the pelvic walls. This is a part 4 lecture on the pelvic wall. I have done a part 1, part 2, and also part 3 lectures on the pelvic walls. If you've not checked that lecture up, please kindly go and do so. But for the purpose of this class, we would be focusing on the lateral pelvic walls. Let's try and use this image here by the side to represent the pelvic cavity. We know that on the lateral side or lateral region of the pelvic cavity is where we have the lateral pelvic wall. And this is the region here highlighted yellow. We have two. We have one on the right and we also have another one on the left. So let's dive into this lecture to establish the different structural components of the lateral pelvic wall. Driving into establishing the different components of the lateral pelvic wall, let's try and establish the different walls that the pelvic cavity represents. Let's try and use this image also here by the side to represent the pelvic cavity. So this is the pelvic cavity here, and we know that the pelvic cavity becomes superiorly continuous as the abdominal cavity. So above the pelvic cavity here up, we have the abdominal space. At the upper part of the pelvic cavity, there is no wall created at the superior part of the pelvic cavity because it is seen to be continuous with the abdominal cavity. While on the anterior region of the pelvic cavity, we have the anterior wall. This is the wall that is seen around the anterior border of the pelvic cavity. Posteriorly, we have the posterior wall, which is the wall, just as the name implies, that is seen at the posterior border of the pelvic cavity. On both lateral sides of the pelvic cavity, we have the lateral walls. We have two. We have one on this side that is arrowed here in yellow, and we have another one on the other side that is also arrowed here in yellow. So we have two lateral walls, while on the inferior part, we have the inferior wall. This inferior wall is also referred to as the pelvic floor. I have put up a lecture on the pelvic floor. If you've not checked that lecture up, also kindly go and do so to keep yourself updated. So these are the walls that the pelvic cavity is seen to establish. But for the purpose of this lecture, we'll be focusing on the lateral pelvic wall, which of course we say are 2 in number. So we'll be dwelling on the structural components of the lateral pelvic wall. So in establishing the structural components of the lateral pelvic wall, we say that the lateral pelvic wall is seen to be made up of bones. So we have bones also contributing to the framework of the lateral wall of the pelvic cavity. We also have membrane. We would be dwelling more on these to establish the specific membrane that is seen around this space. We also have muscles also contributing to the alignment of the lateral pelvic wall. Then we have ligaments. A number of ligaments are also seen around this region. So these are the structural components of the lateral pelvic wall, and would be establishing on each of these components to see how they are positioned and finally seen to align with the lateral wall of the pelvic cavity. So first, establishing on the bone around the lateral pelvic wall is the hip bone. This is also referred to as the innominate bone. These bones are irregularly shaped and they are bilateral, which means that we have one on this side and we have another one on the other side. If you try to look through this image up here, we see that one of these is referred to as the hip bone and they are irregularly shaped. So you have one forming the lateral boundary or wall of the pelvic cavity on one side, and you have another also forming the lateral boundary or wall of the pelvic cavity on the other side. So this is how they are positioned. So in establishing the bones that contribute to the formation of the lateral wall, we will say is the hip bone. If you drive in more into the hip bone, you see that the hip bone has 3 structural subregions. We have the ilium. This is the ilium here, arrowed in green. It is seen at the upper region of the hip bone. Then inferiorly, we have the ischium, and this is the ischium arrowed here at this point. At the anterior part, you see the pelvic, and this is the pelvic here that is arrowed here in blue. So this kind of configuration is seen to be exhibited by the other hip bone on the other side. So these are the 3 structural components of the hip bone. So if you drive in more, and of course on the lateral side of each hip bone, we have a depression or a fossa created that is referred to as the acetabulum. This is one on this side and this is another one on the other side. The acetabulum is created to receive the head of the femur, and this is how the femur fits into the acetabulum, thereby creating the hip joint. And it is through this that the lower limb is connected to the pelvic region. So we have the indentation created at this point. So if we try to drive down using this image down here, this is where we have the acetabulum. Of course, the depression that is stated to be located on the lateral side of the hip bone. And if you look through the acetabulum on the lateral part of the hip bone that is seen to form the lateral wall of the pelvic cavity, you see a triradiate cartilage, which of course is highlighted here in red. You see it forming a demarcation within the acetabulum. And this demarcation is created by the different regions or sub-regions of the hip bone that we initially highlighted. So if you look through this, at the upper part here is where we have the ilium. So the ilium also at the inferior part is seen to contribute to the formation of the acetabulum. Then at the front here, we have the pubic. The pubic also has a contribution here to the formation of the acetabulum. Then finally, we have the ischium at the inferior part, which is also seen to contribute to the formation of the acetabulum. So at this region, you see this triradiate cartilage created at the center. This cartilage tends to disappear around the age of 18, and this is when the bone is seen to completely fused together. And this is where it now forms the hip bone. So if you look at the alignment here, you see that the hip bone is seen to present also a number of transformations, especially at the external part. And this is where it creates an indentation to receive the head of the femur, of course, contributing from the different subregions of its own structural components to form this acetabulum, to receive the head of the femur, where the lower limb will be connected to. Then going further on the membrane, we also stated in our previous slide that the membrane is also a structural component of the lateral wall of the pelvic cavity. And this membrane is the obliterator membrane. This obliterator membrane is a fibrous membranous sheet seen to incompletely cover the obliterator foramen. But how is the obliterator foramen formed? Let's try and use this image here for illustration. This is where we have the hip bone. Remember, we described the hip bone as one of the structural components of the lateral pelvic wall. Around the anterior part, you see a foramen that is created around the space, and this foramen is referred to as the obliterator foramen. This foramen is formed by the different sub-region of the hip bone. Remember, we tried to describe that the hip bone is made up of the ilium, the ischium, and also the pubic. So let's try and use this image here by the side for illustration, considering the region that is demarcated in dotted red as a point of division of separation of the hip bone into the three sub-regions that we initially highlighted. So let's say at this upper part is where we have the ilium, this is where we have the ischium, and this is where we have the pubic. So if you look at the formation of the obliterator foramen, you see that the contribution is just from the pubic and also the ischium. The ilium is not seen to contribute to the formation of the obliterator foramen. So let's drive in through this to establish this fact. So let's say this is where we have the ischium, and the ischium, it has a body. This is the body. Specifically, it is the body region of the ischium that is seen to contribute to the formation of the acetabulum. Remember that the acetabulum receives contribution from the three sub-regions of the hip bone. So we have the body up here, and inferiorly, we have an extension from the body of the ischium, and this is called the ramus of the ischium. So this ramus is seen to contribute to the formation of the obliterator foramen. So this is where we have the ischial ramus. So the ramus, we say, is an extension from the body of the ischium. So going further in establishing the bony alignment of the obliterator foramen, we've tried to describe the ischial ramus. We also have another bone at the front here, which is the pubic. This is the pubic here in the anterior part. This is the body of the pubic. The body of the pubic is the region where we have the formation of the pubic symphysis. Then we have a superior extension from the body. This is the superior extension from the body, and this is referred to as the superior pubic ramus. Then we also have another inferior extension from the body of the pubic, and this is the inferior pubic ramus. And this is where we have the superior and the inferior pubic rami. So we have the formation of the obliterator foramen from the ischial ramus and also the superior and the inferior pubic rami. So it is these two bones that contribute to the formation of the obliterator foramen. This obliterator foramen is then incompletely covered by the obliterator membrane. And this is where we have the obliterator membrane here highlighted in green. You see that this membrane is seen to cover incompletely the obliterator foramen, thereby leaving a space around this region that is referred to as the obliterator canal. You can see how a foramen is being transformed into a canal by a membrane. And of course, this membrane, because it is also positioned on the lateral part, it is classified as part of the structural component of the lateral pelvic wall. Also to add that the obliterator canal that is created as a result of the obliterator membrane incompletely covering the obliterator foramen, we have a passageway that is created for the obliterator nerve, for the obliterator artery, and also the obliterator vein. The obliterator artery is a branch of the internal iliac artery. And if the internal iliac artery, we know it is located within the pelvic cavity, it needs to exit the pelvic cavity so as to supply region outside that space. And the only channel that it will be passing through is through the obliterator canal that is created here at this point. We also have the obliterator nerve also passing through the obliterator canal. The obliterator nerve is a branch from the lumbar plexus, and it also needs to exit the pelvic cavity for it to be able to supply region outside that space. So you see that this canal is not created for fancy, it is created to allow for the passage of some vessels, and this is what we have listed. So also going further, muscle is also seen on the lateral pelvic wall, and the muscle that is seen at this region is the obliterator internus. The obliterator internus, if we drive it into where they originate and also where they are inserted upon, you see that the path that it runs will align with the lateral wall of the pelvic cavity. So they are seen to originate from the posterior surface of the obliterator membrane and also the obliterator foramen. Remember, we tried to describe the obliterator membrane in our previous slide as part of the structural component of the lateral pelvic wall. This membrane is seen to add or create an insertion site for the obliterator internus. So if you look at this image down here, this is where we have the obliterator membrane, of course, incompletely covering the obliterator foramen. And at the end, creating a canal that is referred to as the obliterator canal. This obliterator foramen is formed by the superior pubic ramus, the inferior pubic ramus, and also the ischial ramus. So you see that these three rami are seen to contribute to the formation of the obliterator foramen. This we've tried to establish in our previous slide. So going back to the origin of the obliterator internus, if you look at this membrane, which is referred to as the obliterator membrane, that is seen to incompletely cover the obliterator foramen. You see that it has two surfaces. It has the anterior surface and it has the posterior surface. The posterior surface is behind, and this surface can also be referred to as the pelvic surface. So you have fibers or strands of obliterator internus emerging from the pelvic surface or the posterior surface of the obliterator membrane. Some of these fibers are also seen to originate from the posterior surface of the obliterator foramen. We already described the structural components of the obliterator foramen and the bones that are seen to contribute to its formation. The posterior surface, which of course is at the back, we also see some fibers of the obliterator internus also emerging from this point. And you see these fibers passing through the lesser sciatic foramen. And these fibers, after passing through this lesser sciatic foramen, you see that the fibers are finally inserted on the medial aspect of the greater truncata of the femur. This is where we have the femur here. This is the greater truncata, which is an eminence that is created on the lateral part of the femur. So you see fibers of the obliterator internus after emerging from the posterior surface of the obliterator membrane and also the obliterator foramen. After also passing through the lesser sciatic foramen, the fibers are finally inserted on the medial aspect or region of the greater truncata. So this is the medial aspect of the greater truncata, and this is where they are inserted upon. So through the path by which the obliterator internus runs, you see that they form the alignment along the lateral wall of the pelvic cavity. So this is also taken as one of the structures located around this space. Let's try and use this image here. For the posterior illustration, this is the posterior view up here, and this is the anterior view. And if you look at this muscle in this image up here, that is highlighted here in red, is the obliterator internus. You see that this muscle is seen to originate from the posterior surface of the obliterator membrane. This is the obliterator foramen here around this point, and the fibers are seen to originate on the posterior surface or the pelvic surface of the obliterator membrane, and also the posterior surface of the obliterator foramen. And after the emergence, you see the fibers passing through the lesser sciatic foramen. And this is the lesser sciatic foramen here. This is the greater sciatic foramen above. So it passed through the lesser sciatic foramen. And finally, you see the fibers will be inserted on the medial aspect of the greater truncator of the femur. And this is what is seen here in this image. Another fact that we need to know about the obliterator internus muscle is the fascia of the obliterator internus muscle, because this fascia is seen to be transformed into a canal at a point that allows for the passage of vessels. So the obliterator internus muscle at this point is seen to be covered by a fascia, and this fascia is referred to as the fascia of the obliterator internus. This is the obliterator internus, and this muscle is seen to be covered by a fascia that is referred to as the fascia of the obliterator internus. If you go back to the pelvic floor, let's say this is the alignment of the pelvic floor here, highlighted in dotted blue. We know that the pelvic floor is seen to limit the pelvic cavity at the inferior part. And at this point here, it's seen to connect with the obliterator internus. We know that the obliterator internus muscle is seen on the lateral wall of the pelvic. Of course, there will be a point where these two muscles, which are the pelvic floor muscle, which is seen to line the inferior limit of the pelvic cavity, and also the obliterator internus muscle that is seen on the lateral part of the pelvic cavity. So there's going to be the communication of these two muscles at this point. And at the lower part here of the point of intercept, where the pelvic floor muscle and the obliterator internus muscle meet, is where we have the formation of the Alcus canal or the pudendal canal. This canal is formed by the fascia covering the obliterator internus. And at this lower end here, you have the transformation of this fascia into a canal. This canal is not created for fancy. It is created to allow for the passage of the internal pudendal vessels and also the pudendal nerve. So we have the internal pudendal artery here highlighted in red, passing through this canal, and also the internal pudendal vein. We know that the internal pudendal artery is a branch of the internal iliac artery. The internal iliac artery is located within the pelvic cavity, and it needs to give off branch, which is the internal pudendal artery, that needs to pass through this canal so as to supply regions outside that space. So that is why you see that the internal pudendal artery is seen to pass through the Alcus canal or the pudendal canal. You also see the pudendal nerve. The pudendal nerve is one of the branches of the sacral plexus, and we know that the sacral plexus is located within the posterior lateral wall of the pelvic cavity. The pudendal nerve is also seen to pass through this canal so as to supply regions outside that space. And when you look at how the establishment of the Alcus canal or the pudendal canal is, you see that it is located at the lateral wall of the ischial-anal fossa. This is where we have the ischial-anal fossa here at this side. It is a fossa that is created or located on both sides of the anal canal. Let's say this is the anal canal here, highlighted in yellow, and on both lateral side of the anal canal is where we have the ischial-anal fossa. And if you look at the placement of the Alcus canal or the pudendal canal, you see that it is located on the lateral side of the ischial-anal fossa. And this is how this canal is positioned, where it creates allowance or passageway for internal pudendal vessels and also the pudendal nerve. The next structures are ligaments. We also have a number of ligaments also contributing to the lateral pelvic wall. We have a sacrospinous ligament. This is the sacrospinous ligament here, arrowed in blue. We know that the sacrospinous ligament, as I've always said on this channel, is for us to break down the name. It means the ligament that connects the spine of the ischium. This is the spine of the ischium here, and connecting it to the sacrum. So you see ligaments running to and through this region, and this is referred to as the sacrospinous ligament. Remember when we tried to describe the posterior pelvic wall, we tried to highlight the sacrospinous ligament also as a structural component of the posterior pelvic wall. But we specifically established in that lecture that it is the posterior region of the sacrospinous ligament, while the lateral region of the sacrospinous ligament is what is seen to contribute to the lateral pelvic wall. It's good for us to be able to establish this distinct presentation. Then the second ligament that is seen around this region is the sacrotuberous ligament. This is the sacrotuberous ligament here at the inferior part that is harrowed in yellow. This sacrotuberous ligament, all we still need to do is to break down the name. It means a ligament that connects the tuberosity of the ischium. This is the tuberosity of the ischium here on the lower part, connecting it to the sacrum. And at this point, you see that it tallies or aligns with the lateral wall of the pelvic cavity. We also need to add that it is the lateral region of the sacrotuberous ligament that is seen to contribute to the lateral pelvic wall alignment, because we described also in our previous lecture on the posterior pelvic wall that it is the posterior region of the sacrotuberous ligament that contributes to the structural component of the posterior pelvic wall. But for the lateral pelvic wall, it is the lateral region of the sacrotuberous ligament that is also seen to contribute to the structural component of the lateral pelvic wall. So it's good for us to be able to establish this distinct presentation. If you look at the pattern by which the sacrospinous and also the sacrotuberous ligaments run, you see that they extend from the posterior region where they have their insertion point on the sacrum to the spine of the ischium and also the tuberosity of the ischium, which is, of course, it's located on the lateral side. So as they run through that course, you see them forming alignment with the posterior pelvic wall and also the lateral pelvic wall. So it's important for us to establish the specific regions depending on the walls that we are trying to describe. So thanks for watching this video. Let's continue to stay glued to this channel.